You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. With us, we have two periodontists, Dr. Heller and Dr. Versman. Dr. Heller, welcome to the program.
Thanks for having me.
Dr. Versman?
It's a real pleasure to be with you today, Randy.
Now, before we get into today's topic, dental implants, tell me a little bit about your practice.
Love to. We've practiced in the Aurora area for over 30 years, Randy.
Okay.
Specializing in periodontics. Periodontics, as you may know, is one of the 7 specialties in dentistry.
What is it, by the way? What is that specialty?
Well, the design of periodontics is to save the natural teeth. And unfortunately, as time has gone on, many of patients lose their teeth, and so our focus has become on replacing teeth with dental implants, which are just new biological wonders that work terrific for patients.
Okay, Dr. Heller, now by the way, you're both periodontists.
Correct.
What's your role in the practice? I mean, do you do the same stuff?
Yeah, basically we do the same procedures. We take care of people. We're doing implants all the time. It's something that we do other forms of treatment as well. But
like what?
Well, in the past we've done a lot of cosmetic, treating gum disease, cosmetic treatment. But what's really nice now is with implants, we can remove teeth and put teeth in almost at the same time.
Okay, now your background and training. You both teach, you're professors. Tell me about that.
Well, it was interesting. When I first came to town, Randy, I came into the practice. Dr. Versman had been there for a long time. I started the kind of at that time, and I really didn't have any people to treat. You know, I had all this good knowledge. I went to school. You learn a lot about implants, a lot about dentistry, and I didn't have any patients. So what I did at that point was I started at the school teaching some of the undergrad students, the dental students.
Yeah.
And I've continued that throughout the years, even to this day. I go once a week, one morning every week, and teach in the perio department, doing surgery, dental implants, and whatever else is needed over there.
Okay, so I understand this correctly. The periodontist places the implant, the titanium root in the mouth, and then you have another dentist, like a general dentist, that will put the tooth structure onto.
That's how we do it. In our office, we've had the opportunity to work with some wonderful dentists who are really great at what they do. What really our expertise is in the surgical phase. And so it's nice. It's really great for the patient. They get the opportunity to see us to do the actual placement of the dental implant, which is really kind of a benign procedure.
Okay.
And then they get the opportunity to work with their general dentist, whose expertise is doing the cosmetics. So the beauty of it, Randy, is they get the benefit of everybody's expertise.
Now, do people need to see or get a referral from their general practitioner, general dentist before they see you, or can they call you directly? How does that work?
A lot of our patients, Randy, they are referred by referring dentists who want us to place those implants, but many of our patients call directly, and we're very happy to see them and to work with their dentist or to refer them to some of the high-quality people that we have the opportunity to share responsibilities with. And so it's great.
It's also interesting, too, because we do get patients that will send their friends or family, and that's always nice as well, because we get the opportunity to help them.
Now, you don't look like a dentist especially.
Well,
did you always know you wanted to be a dentist? I asked that to every practitioner on the show.
You know what? I did.
Is that right?
Years ago, in about probably 9th grade, I had an opportunity to go volunteer as part of our school program, 9th grade.
Okay.
And it's funny because I remember at that point going to down to the dental school for a couple weeks volunteering. I thought I had this great big job.
Yeah.
Really, it was nothing. But the funny part is now that I've been teaching there all these years, I have this recollection of these people there that look so old.
Yeah.
And now I'm miles beyond in age what those guys are.
But I've got him beat, Randy. I wanted to be a dentist since 5th grade.
Is that right?
All my life, practically all my life.
You just knew you want to be that. I mean, you both love this? I mean, you like doing this?
Love what we do. We have a passion for it. We have a passion for the profession, and most importantly for our patients.
Now, we've invited you on the show to talk about dental implants, and you say in all areas of dentistry, probably the happiest group of patients. Why is that?
Oh, because we're able to change people's lives, Randy. I mean, I'm telling you, it is so gratifying. People actually walk out of the dental office with hugs because we've been able to give them their self-esteem back, their comfort in chewing. We've been able to give them a beautiful cosmetic smile and confidence that they can chew and eat anything that they want. And
is that right, though? I mean, they're strong, these dental implants. You can chew whatever.
Unbelievable. They are so strong. It is something. Let me just give you an example.
All right.
I brought a little model here, and it has 2 implants that help hold in a denture, Randy. I'd like you to pull that off for me.
Okay. Okay, well, my hand, let's see. It's pretty good.
It's pretty good, isn't it?
Is this upper or lower?
That is a lower, and that's where people
So just 2
usually,
implants.
at a minimum, 2 implants can give people stability. They can eat anything they want. I was born and raised in the Midwest, Randy, and corn on the cob is my favorite. And people can eat corn on the cob, they can eat apples, they can do anything.
Actually, it's funny because it's one of the things that they always ask us, can I eat steak? Can I eat corn? Can I eat these things? And you really never realize that they couldn't eat that before. I mean, it's really interesting because we don't think like that. If you have all your teeth, you're able to generally chew and eat whatever you want.
What are the age ranges of these patients that you see?
Anywhere from 16 all the way up to 97. That's the oldest patient.
97. Now, why would a 97-year-old want to go through that process?
Well, because 97-year-old patient that came in that I had opportunity to treat had all of her teeth but broke a tooth and did not want to wear a removable partial. We brought a model to show you. This is a removable partial, excuse me, Randy.
All right.
And it has hooks on it that clasp onto teeth. It tends to weaken the teeth, and it also isn't very cosmetic. And this woman did not want to wear something as obtrusive as this, and so we were able to place 1 implant to replace that broken tooth.
So 98-year-old.
Unbelievable. And she's still doing beautifully. She's about 101 right now and still comes in to see us, and we still get the hugs from her all the time.
I have a 73-year-old mother, and she says to me, you know, I told her I'm going to interview you guys, and she's been in a denture since she's 30, so she's or 28, and she's 73. She says I'm way too old. I've been told I'm too old for dental implants.
Absolutely not.
I mean, is that a common?
It is very common. People don't believe that they may be candidates that at one time they lost their teeth due to gum disease. They think their gums are weak. The gums have very little to do with it, Randy. It's the bone that holds in the teeth, and almost everybody has enough bone that they can have an implant placed. And the neat thing is, people are overwhelmed how easy it is to go through the procedure.
Okay. What about pain, though? I mean, it sounds very painful.
Pain is just something our patients don't complain about. It amazes me even to this day, as many implants as we've done over the years, that we just don't get anybody complaining about it. It's something that they'll take some ibuprofen.
But is that the #1 fear, by the way? Pain? They don't want to go through pain.
Absolutely. I think that's the greatest fear that keeps people from going to the dentist in general. And I always tell my patients...
People don't like going to the dentist still. Is that correct?
That is correct, but it's unfortunate because dentistry has changed so dramatically. So today, it is a very comfortable environment, and we work very hard to listen to our patients, to understand what their concerns are, and to overcome those so that they can go ahead and have this treatment, which they will absolutely love for the rest of their lives. Because implants, although not always, not 100%, we expect them to last forever. That's how great they are.
So do they fall out?
No.
No, on a real...
Any stats on that, by the way?
Yes.
Nationally?
Yes.
Probably 97, 98% success. It's really tremendous.
So what are the different categories of dental implant patients you see?
Well, probably one of the more common ones is the patient that's lost one or 2 teeth.
Okay.
And what's happened in the past, Randy, is they didn't have the options of dental implants, and so at that point they had to go through what we call a bridge or another restoration, where they would do is cut down teeth on the right and left side, they'd grind them down and then glue on teeth on both sides. That was great. Patients liked that. But the reality of it is that they just didn't last. The average studies would show 8 to 12 years of success. And so then it became kind of a snowballing effect in that...
I mean, is that where it starts, by the way? You lose 1 tooth, then slowly things happen?
Yeah, it really can.
Is your hunch or theory, or maybe it's a fact that by losing that one, that or by putting in an implant, maybe you could stop that loss?
I use an analogy, Randy, it's like a brick wall. And if you take a brick out of the middle of the wall and don't replace it, then the mortar starts to break, and pretty soon a few more bricks come out, and it does snowball.
Is that a realistic comparison, though?
Oh, absolutely.
Yeah,
it is.
Okay.
Absolutely, Randy.
Why, though? Why?
Well, the problem is when you do a bridge, as Doug described, which used to be the ideal treatment and the only really good option before implants, people would get decay under those bridges and lose the teeth. They would have to have root canals. The bridges would break. So today we don't have to touch the adjacent teeth. We can leave that enamel perfect.
Okay.
And so we just put an implant in the 1 or 2 areas where the teeth are missing, and the solid, strong, healthy teeth, we leave those alone. And those teeth then hopefully will last for the rest of that patient's life.
The other beauty is it keeps a one-tooth problem a one-tooth problem, so you don't get a 3-tooth problem or a 4-tooth problem years later.